The 4160 post clamp is designed to be attached to the OR table bed rail by the circulator nurse with a tightening knob on the bottom. For mid-sternotomy, attach the clamp to the table rail approximately 2 inches below the patient's axilla on the side to be dissected. Clamp position may change or be adjusted according to age and size of patient or physician's technique or preference. Open the jaws completely by turning the cross handle counterclockwise all the way until it stops. Hold the clamp jaws with one hand and the post with the other. Check for free movement of the jaws by squeezing them together and then releasing. Before attaching the clamp to the table rail, check for possible obstruction. Now is a good time to take note of where the rail mounting bolts are located that are holding the rail to the OR table. Hold the clamp by the upper and lower jaws with one hand and slightly tilt the upper jaw inward toward the table. Place the upper jaw over the rail, then pivot the lower jaw inward toward the table. Both jaws should be in line with the table rail. Squeeze the jaws together to assure there is no obstruction between the jaws and the rail. While holding the jaws closed, securely tighten with the cross handle. Now you see I'm holding the jaws closed and tightening the handle. You do not want to try to tighten and close the jaws with just the handle because it will not tighten securely to the bed rail. You need to squeeze the jaws, hold them together, and then securely tighten with the cross handle. When pulling on the body or the post of the clamp, there should be no movement when applied properly. If the clamp has movement, you'll need to squeeze the jaws together, loosen the handle, readjust the clamp, squeeze the jaws together, hold the jaws together, and then tighten with the cross handle. This clamp is securely tightened to the OR table bed rail. To remove the 4160 post clamp, place one hand around the clamp jaws to hold them together during removal. Loosen the cross handle by turning counterclockwise until it stops. All the while you're holding the jaws closed, squeezing them together while loosening the handle. A slight wiggle of the clamp will release the clamping pressure, which allows the spring-loaded jaws to separate.